Well, thank you very much, Lisa, and thank you for having me on, and thank you for all the great work that ALEC is doing. I want to thank Dr. Laffer and Steve Moore and everybody for the great work this organization is doing. What I thought I'd do here today is just talk a little bit about what Nebraska is doing in response to the coronavirus pandemic here and how we've handled it in our state and what some of the results have been to this state. As many of you know, this pandemic hit us in, February, March timeframe. It was March 13th when I first declared a state of emergency, and the president put the 10-person rule in effect on March 16th. And so we had a number of restrictions in place that was designed to slow the spread of the virus. Now, it was about that beginning of March when I was getting briefed by our local public health experts, and we're blessed to have some great folks at the University of Nebraska Medical Center. These are folks that have dealt with the Ebola virus, for example. This was the group that took some of the folks, the Americans that were in Wuhan, some of the folks that were on the Diamond Princess, and quarantined them. We've got the only federally quarantined space in the country. We also have one of 3 biocontainment facilities in the country. And so we're really getting top level advice. And at that time, what they told us was, look, it's a virus. You can't stop it from coming. But what you can do is slow it down enough so that you protect your hospital capacity so that you can provide that acute care to anybody who needs it, that hospital bed, that ICU bed, or that ventilator. And they gave us some of the data they had based on what they thought we could expect to see, based on how many people get it. So they said, if you hold the numbers down, you'll be able to provide that. So that's really been our North Star, our guide, as we've been putting all these policies in place. And I think it's important to note because, again, this is something we got to manage potentially for the long term with regard to the virus, and protecting that hospital capacity to treat people is a way that you can do that is, you can really measure and make sure you're doing versus a lot of some of these other things which have come on afterwards around case counts or positivity rates or things like that, which really may or may not matter depending on the circumstances and are very variable depending on how you're doing your testing, and they're certainly not consistent, and so very difficult to make decisions. So with that goal of preserving our hospital system, what we did is we put together a plan that involves 6 pillars. The first is testing and making sure we could do adequate testing, and that was something that was a challenge early on with regard to this pandemic because nobody really had that testing capacity. One of the things we've done here in Nebraska is that we've hired a firm called Nomi Health to be able to provide us with testnebraska.com to be able to expand the testing that we're doing in our public health lab that was going on with the commercial labs and at University of Nebraska Medical Center. And that's really helped us create a robust way to do testing. And that's really been important here over the last couple of weeks when we saw that a lot of the supplies were getting moved to the southern states for obvious reasons. We had more cases there. But for example, UNMC had to shut down one of their testing sites because they ran out of supplies. While we had our own supply line through Nomi Health, we were able to continue to do testing because we control our own destiny, essentially. So that was a key factor of how we've been able to continue to do testing. We've also been working on the second pillar, which is beefing up our contact tracing. So again, the kind of blocking and tackling of epidemiology and handling pandemics is testing and contact tracing. You find out who is tested positive, you isolate them from the rest of the community so that they don't infect anybody. You contact trace everybody they've been associated with, get them to quarantine if necessary, if they've had a close level of contact, and that's how you control the spread of the virus. So we've set a goal of having 1,000 contact tracers at the state level to be able to supplement what the work that's going on in our local public health departments. Overall in the state now, we've got 949 contact tracers trained. We're only using about 400 right now because we just don't have the demand. But we want to have the capacity to be able to bring that up if we need to be able to make sure we can get on top of any outbreak very quickly and get that isolated and contained. So that's an important part of our strategy. The third part of our strategy was making sure we had quarantine space for anybody who could not safely quarantine at home, whether it was our first responders, our healthcare workers, food processing plant workers, just general public. We've made arrangements with University of Nebraska to be able to use their dorm rooms. We use hotel rooms, and we've been able really to provide that space to anybody who has needed it. Our fourth part of our pillar, our fourth pillar was having appropriate personal protective equipment. And you all may recall at the beginning of this pandemic, that was a challenge. So we've leveraged the buying power of the state. We've worked with some of our private companies Werner Trucking, for example, had great connections in China and was able to help us transport. So we worked to be able to bring that PPE in. And now we've got at least 90 days supply on hand for all of the PPE that we need, and in some cases up to a year. And we're providing that to our local public health departments, who then spread it out to dentist's office or hospitals or long-term care facilities or first responders, volunteer fire departments, you name it. That's where we make sure that everybody's got that appropriate gear. Then the next step is to make sure that you're addressing those at-risk populations with plans. So we've done that around our long-term care facilities. We've asked all of them to supply us with plans with regard to how they're going to manage this pandemic. We're also doing testing for our long-term care facilities to make sure their frontline staff are free of the virus. We've moved residents where we've had to, when a long-term care facility has not been able to say adequately staff the facility. We've moved people out. We've had plans to do that. We set up space to be able to do that and all that. And that's actually helped us keep our fatalities in our long-term care facilities under 1%, when some states have experienced 10% or more. I think New Jersey was actually up to 18%. I will also want to credit the work that we've been doing with our infection control assessment and protection program, which we've had in place for 4 years here in the state, to be able to help train long-term care facilities about their infection control, and the great work that University of Nebraska Medical Center has done to be able to continue to train people. They do on-site training. They go visit to help facilities look at what they can do better. We've done over 60 of those visits already. We also do webinars and so forth to really help train those folks. We've done something similar for our food processing plants. It's an environment very difficult, like the long-term care facilities, to socially distance. So UNMC put together a COVID meat processing handbook. We had weekly calls with all our food processors to get them to adopt those best practices. And where we had a lot of our early cases were coming from food processing plants. Now for the last 2 months, each of those counties where we've got food processing facilities has been down to single-digit case counts for, the last 2 months. So we've really got it under control. And that also was about doing the communication to the communities that serve food processing plants, because English is often not their first language. And so we did videos in Karen, Spanish, French, Somali, Arabic, getting the message out about what you can do to protect yourself and your family with the coronavirus, and emphasizing social distancing. So again, reaching out to communities as well as the companies to be able to get that under control. So that's just a couple of examples of some of that. And then finally, we put in directed health measures to put restrictions in place to be able to help slow the spread of the virus as well. But I want to point out with this is that we were one of 7 states that didn't issue a stay-at-home order or a shutdown order, or whatever you want to call it. And that's because we didn't feel that that was the best approach, at least not for Nebraska. What we said is we had a targeted campaign where we said, okay, we're going to have 21 days to stay home, stay healthy, stay connected. In fact, I totally ripped that off from Doug Burgum and Doug Ducey, a couple of my colleague governors, and I don't even usually give them credit for it. But we asked people to stay home during what we thought was going to be the peak, so we could slow the spread of the virus while we built up those other resources. And it was successful. Nebraskans did the right thing. You ask people to do the right thing, they'll do it. You have to communicate to them why they're doing it and explain, but we did that here in Nebraska, and we've been very successful. We did targeted shutdowns of things like tattoo parlors and salons and so forth, but really only businesses that were really at risk, and we try to do it for the minimum amount of time possible. We didn't do a broad shutdown order. And what that means is when you want to have people start returning to a more normal life, it's easier because they never completely left it in the first place. So we've been asking Nebraskans to do the right thing, and they've been doing it. I think part of the key to these directed health measures and what we're doing on these restrictions is also communication. I did weekday daily press conferences to explain what was going on, to say when we knew when we were doing a good job, and sometimes when we weren't doing a good job. We were very transparent about our efforts. We explained our strategy, those 6 pillars I just laid out to you. We went into details about them. We also started doing twice weekly Spanish language press briefings, so that, again, we could reach out to communities where English was not the first language to be able to help them with regard to social distancing and all the things we were asking people to do. And so as we go forward, we're continuing to make sure we've got robust capacity in those 6 pillars that are addressing our hospital capacity. We're continuing to remind people about our social distancing rules, like hey, stay 6 feet apart from people when you're out in public, wear a mask when you go to the store, wash your hands often. And then the blocking and tackling I mentioned earlier with regard to testing and contact tracing to get on top of cases and get them to isolate quickly. And through that, we've been very successful in managing our hospital system. Today in the state of Nebraska, we've got 38% of our hospital beds are available, 38% of our ICU beds available, and 80% of our ventilators are available. And again, throughout all of our communication, we've just focused on that hospital capacity as the key thing to be able to make sure we can provide that hospital bed or that ventilator when somebody needed it. And that was really the key thing for us. So we've managed our hospital system to be able to do that, work together across the state, so that if we had an area that was more heavily impacted, we moved patients out to make room for what we projected new patients coming in. And that's how we were so successful in making sure we preserve that hospital capacity. We never got tied up in the other stuff that people tried to, and other things like case counts and positivity rates and so forth. We say focus on hospitals because that is the key to providing the care to keep people safe. So that's been very successful. And what that's also allowed us to do is, as we received the CARES Act money, we very early on distributed that money out to be able to help us start growing, recovering and growing. So we set aside about $330 million for small businesses, about $100 million of that money for our livestock producers. We put $16 million into retraining people so they can take a better job, because we still have a lot of jobs out there that are available. Before the pandemic, our biggest issue was workforce. And frankly, it's still the biggest issue in our state is workforce, having employers find the people they can hire. So we put $16 million into that. We put $40 million into rural broadband to be able to help connect our rural communities. And then we've also put money into nonprofits. We set aside $85 million for our nonprofit community, especially focused on childcare, so that, again, people would be able to go back to work. We also put about $427 million aside to be able to shore up our unemployment insurance fund to make sure that could continue to be robust. And then, of course, we're working with the federal government to reimburse local governments as well as the state to be able to do the things we need to do with regard to PPE or the other expenses that go along with managing this pandemic, and especially paying for that testing and contact tracing that I said was so important to be able to make sure you stay on top of this. So here in Nebraska, we reached our peak cases on May 7th. Our peak hospitalizations occurred on May 27th at 232 people in the hospital. And now we're down, we've seen a steady decline since then. We're down to about 100 people in the hospital today. Only about 26 people with coronavirus are using ventilators here in the state of Nebraska, out of about 750 ventilators that we've got available. And in fact, as I mentioned, we got 80% of our overall ventilators are available here in the state of Nebraska. We've also, as we've allowed people to go back to a more normal life, we've really been successful there as well. We've got the lowest unemployment rate in the country at 5.2%. The next nearest state is Utah at 8.5%. And we've got I think our mortality rate in the state is about 1.4%. So that's the fourth lowest in the country. And then last week, the Bureau of Economic Analysis came out and said that Nebraska's economy has been the least impacted of any of the 50 states. Our GDP for the first quarter was down 1.3%, which is obviously still down. But you compare that to the national average of being down 5%. In states like Nevada and New York, we're down 8.2% just in that first quarter. So that's all been very good news for people getting back to work. And what that's also helped us with is with our state budget. So we had a very strong position. We've been managed very conservatively here in the state. We've been controlling our spending, leveraging things like Lean Six Sigma, better process, better technology to be able to do a better job of serving our people and controlling our costs. In fact, we, before the pandemic, had the lowest level of employment at state government we've had since 1994. We've been controlling our spending. And so we had a strong, we were well ahead of our forecast as far as the budget going into March in a very strong financial position. Now, obviously, that changed somewhat with the pandemic, but even with the economic slowdown we experienced, we just wrapped up our fiscal year, June 30th, and in fact had a surplus over our fiscal forecast from July of 2019. And in fact, we actually grew our state economy, our revenues rather, compared to where we were a year ago with regard to that. Now, it wasn't big. We only put about $10 million into our rainy day fund, but still that shows that we were able to manage this in a way that was fiscally conservative, We've been able to meet our budget applications. Certainly during the pandemic, I've been continuing to control our costs. And so we finished the fiscal year very strongly. And that's despite the fact that our income tax revenues largely got moved from April to July because our state income tax system follows the federal codes. When the federal government moved their deadline to July 15th, a lot of our taxes got moved to July 15th as well. So we're starting off this new fiscal year in a situation where we've got our income tax revenues from the last fiscal year coming in. We will be impacted by the tax relief that's in the CARES Act, again, because our code follows the federal code. So we expect to have $125 million less in revenue because of that. We'll manage that. And then, of course, whatever the impact of the economy is. But again, it's not going to be, we're not going to be 10 or 25% down that some, doom and gloom naysayers have said. We're going to be able to manage this within our means. And again, while we're very appreciative of the CARES Act money to be able to help respond, I know there's been talk of another stimulus package, and that's one of the things that I just can't support. Look, if we just continue to run up the debt, trillions of dollars as we've done already, we're just burdening our children, our grandchildren, our great-grandchildren with really no way to pay this off. And what you're doing is you're penalizing states that have been conservatively run, like Nebraska and my other colleagues here in the Midwest. I was just talking earlier with Iowa and North Dakota, and they're in the same spot we are with regard to strong fiscal position going into this fiscal year. You're penalizing states that have done the right thing at the expense of states, like us, and you're benefiting states that have done the wrong thing, so that have been fiscally irresponsible and have run up their state government. For example, the state of New York has a smaller population than the state of Florida, but I think their state spending budget is much bigger. I think it's almost double. So the point being that you've got significant disparities between how states are being run, and another stimulus package will just run up our debt and penalize the states that are doing the right thing. So I think that if the federal government wants to do something, what they should is just give us more flexibility with the money they've already sent out, because you're not going to get that money back anyway. You're not going to get that money back. Let us do with what we want. Hold us accountable for how it's being spent, obviously. Make us report back to you. But don't add on to more of our debt by having another stimulus package that we really can't afford, and that is just going to punish the states that have done well. So with that, Lisa, I'm going to go ahead and wrap up and turn it back over to you for the rest of the program. But again, thank you very much to ALEC for all that you do to help our state legislators make sure we have good policy that helps us run our states in a conservative manner, so that we can be in a strong financial position when we do have emergencies like this, because that's why you do this. You do it to be able to make sure that you can handle what comes up and do it in a way that is not going to unfairly burden your taxpayers and allows your state to continue to grow, create job opportunities. And at the end of the day, that's what it's all about, is making sure that you create those opportunities for the families in your state. And that's what we've been doing here in Nebraska. So thank you, Lisa.